You've made it to Chiro Hustle Live. Sit back and learn from the greatest influencers in the profession. This week's episode is brought to you by Close for Chiro, Legacy Wealth Management, Posture Screen, Imaging Services, Chiro Thin, Universal Tractioning Systems, Chiro Moguls, Zingit Solutions, Dr. Peter Goldman's Zone School of Healing, Evers Coaching Systems, Rhino Coaching, Chiro Matchmakers, Bax Max, 5-Star Management, and the Goodman Factor. Let's hustle. Hey guys, Jim Chester here. This is an afternoon edition live stream of the Chiro Hustle podcast. I have Dr. Evan Katz coming in from Boulder, Colorado, and we are both coming in from the beautiful state of Colorado. And I am coming in from Grand Junction, which is in the Grand Valley on the western slope. And I moved here to get away from everybody over there. And
just keep sending up those peaches, those western slope peaches, and we're good.
But today's episode is brought to us by Jason Yeager and the Universal Traction System. If you guys are interested in getting people better outcomes and better results with their health through their spinal curvature, I'm going to float Dr. Jason's web address on the bottom there. It's utsspine.net. If you are looking to get curve correction therapy going into your practice with chiropractic biophysics, this is something that you want to implement into your practice. So, Dr. Evan, one of the things that we're talking today about is research. And I know you guys are doing some amazing things with research. And you're working with some particular things that most people don't know about right now. So let's kind of let people know what's going on and what the direction we're going with research right now.
Sure. First, I just want to say I appreciate you and everything you're doing, man. So I appreciate that. And hopefully I'll see you soon in Colorado because I need to get to the western slope, especially when those peaches start hitting. But yeah, so I appreciate you. And I appreciate you for having me on here. So let's see, the research, I mean, we just did a research article that we got published in the Journal of Brain Circulation, where we showed that patients with abnormal neck curves or like subluxated necks have a decreased blood flow in their cerebral arteries into their brain. And we did that with a number of patients where my wife and I were treating patients, and throughout probably the last 7 or 10 years, we've seen patients with abnormal curves and instabilities, and we wanted to look to see if it caused anything. And we actually started initially in the hospital in one of the surgery suites with their docs, and we saw that there was instabilities, and then they pumped dye in the arteries, and they put their neck into the position we saw the abnormality, and we looked to see if there was abnormal vascular flow. So then we took it another step further, where then we started saying, well, what if we just do angiograms? You know, there's no dye, there's no really negatives to do in an MRI, so to speak. And we wanted to look to see if their vascularity was fine, because a lot of these patients were hit or, in crashes, and a lot of them had dizziness or headaches. And, and I'm a jiu-jitsu guy, and if you get someone in like a really nasty blood choke, you don't know it until you almost pass out or until you wake up. And a lot of these patients started to explain that's what it felt like. And I was like, wow, it sounds like a blood choke. So there was a paper that was published in, I think, Medical Science Monitoring, where they looked at abnormal neck curves decreased the vertebral artery hemodynamics on ultrasound. So we started saying, well, what happens upstream? If it's being turbulent down here, the vertebral artery goes through the foramen magnum into the brain. That's what feeds our brain. So we wanted to look, are these patients vascularly compromised? So we knew they had an abnormal curve. We knew what some of the studies suggested on vascular, but then we took it a step further, and I went to the MRI center here, and I was like, hey, I have this idea. I want to look at vascular on these patients to see if they're intact. And then we put them on cervical traction on a Denerol that we had to cut to fit into the MRI machine. It took a lot of work. And then we angiogram them, knowing what their necks looked like in their normal position. And then without them getting off the table, we put them on this Denerol and looking to see like a positional angiogram. And then we found that when we actually restored their neck curve, as it went to, we had the pre and post, without them getting off the table, the blood flow through what's called pixel intensity, how you measure it. And we hired a PhD and software, and we found that abnormal neck curves decrease blood flow up to 225%, or increasing their neck curve increases blood flow up to 225%. So we did it on a number of patients, and we looked and we're like, wow, we're starting to see something. So we started talking to some radiologists and docs. We're like, take a look at this. And then we decided after, I think we did 14 or 16 angiograms pre and post, we wrote it up and we found the exact same thing in each patient, that abnormal neck curves, or truly a subluxated neck, decreases blood flow to the brain. And at that same time, the Alzheimer's Association and Dementia Association came out and said that one of the number one hypothesis for Alzheimer's and dementia is decreased blood flow to the brain. And we're like, oh man, we'd be, crashing Lamborghinis if that was a drug we developed. We're like, hey, check out this drug that increases blood flow. But really the only thing that can fix that is chiropractic care. Outside of surgeons are now trying to fuse into a normal lordosis. But we know that this is happening. And most of the docs we've talked to and have shown this to, including, I think, Dr. Curtis Fedorchuk, who was on the paper, and Dr. Douglas Lightstone, who, were huge helps. They've been showing this to Emory and Emory's now. And we're just looking at look what can happen. This is a structural problem that is that's been published a lot to show there's a problem. But now we have a paper that actually shows abnormal neck curves can cause this, but it's also a way for us to help educate patients on the importance of our care and to validate our care if we're trying to improve the curve. Like, hey, this patient doesn't have pain anymore. Yeah, but there's some good studies that suggest that if we leave their neck this way, it can decrease blood flow to the brain. And what does that lead to? I don't want less blood flow in my brain.
Well, so, it makes me think about this, is that life is motion and motion is life. And if we turn off motion inside of the body, then less life is flowing through it. And that's really the real give, love, serve part of chiropractic. But there's also the science, philosophy, and art that most people might not know so heavy about. So what you guys are really focusing on is the science behind it and why it works for people.
And I think it's also, with the philosophy aspect, is I think there's so much science out there that backs up the philosophy, right? So some of the philosophy I look at, I'm like, it's not even philosophy anymore. We know this. So this is science. Why? There's a philosophical aspect to it, but I also think that every day more stuff is being published to show that the philosophy of chiropractors for over 100 years is actually science. And it's really not even philosophy anymore. It's just, where do we branch off from there? Okay, let's say we get funded and we can do bigger studies of this blood flow. And let's say we find that we are making this major difference to brain circulation. And then we start to look at, okay, well, what happens if your brain has less blood flow? Is that healthier for you? Well, that's what chiropractors have been saying all along. And how does that improve the vascularity to your spinal cord? And what does that do? So I look at it, I'm like, I don't even think that's a philosophy anymore. The science is so strong to validate what it is that we do. But I feel personally, a lot of our profession kind of shies away from the research, even though I'm like, you do know the research only validates this, and not even chiropractic research, but most neurosurgery research, most of the neurosurgery stuff that's coming out, I'm like, dude, you guys are hooking us up because we can do this without cutting people open and fusing them. And, so what we're doing is completely appropriate.
Yeah. The things that I find that you're excited about is, I bet right now people are watching, they're going to have somebody in their family that has some type of neural development disorder, whether it's Alzheimer's, dementia, or some type of developmental problem, or some type of anxiety or depression problem. And most people don't realize that the oscillation of blood to the brain is a condition moderator for how people inherently feel anxiety, how they inherently feel headache, how they inherently feel these things. It's a moderation of the oscillation of the systems.
Have you ever been almost choked out?
Oh,
You're not just sitting there chilling. Your sympathetics are firing until you're out, So, and it's really funny because the MRI tech that we used, he's on the paper. His name is Mark, and he's not a biomechanist or really understand the spine to that degree. He's a super smart guy. But when we started putting these patients' necks into a lordosis, he's like, oh, that looks so uncomfortable. But then what happened was every patient was like, oh, I cannot tell you how much better this feels. And then I started educating. He's like, man, that makes sense. Like the only people so far that have come to me that have said it doesn't make sense are a couple chiropractors that I think do mostly IMEs. But, we've shown this to neurosurgeons here. And one of our patients is a Harvard cardiologist, and I showed it to her, and she's like, yeah, it totally makes sense. We have ultrasound in our office. It doesn't even they're like, oh yeah, totally. That totally makes sense. But for some reason, I've gotten some pushback from our own profession on like, well, it wasn't this and that, and no way. And I'm like, really? Like, let's just take chiropractic at this. Let's look at it from the spinal perspective. You think a buckled neck with subluxated joints impinging on the vertebral artery doesn't affect anything?
Yeah, it is baffling, but that's a part of this title of this live is confusion, and people are definitely massively confused about where the research is and what you guys are doing, to where they look at like 1895 chiropractic. So,
right. And I think the research now has validated what they've been saying since 1895. With this, the technology wasn't there yet, and what we know now is going to be so much different than what we know in 100 years. Oh, I hope, because we just keep learning more and more. And the more and more that we learn is not diluting chiropractic. I feel it's strengthening it, because right now we're at the point in our profession and in the world of science, especially with the spine and the nerves, it's a mechanical. Most of these problems, headaches, or even arthritis, abnormalities, dysfunction, is a structural problem. So if it's a structural problem, then you need a structural solution. What else is a structural solution? Surgery, they confuse it, but then you have problems with that. But there's no drug that fixes the structure. There's no shot that fixes the structure. There's some shots that can help, like PRP and stem cells, but they're still not fixing the structure. So that's us. But for whatever reason, our own profession still was arguing with me on this paper. I'm like, really? You don't think this is... I don't know what to tell you. Okay.
Well, we're really getting philosophical then, because it is a limitation of matter.
Well, sure. All right. There's limitations to matter. But if we also keep matter in a certain way, then you're increasing or decreasing the load in the structure, and then that matter will change. So if we can get to it before, then we can minimize the limitations of that matter by preventing it from breaking down. So we're not giving it that limitation in the first place. And that's what the research is really suggesting. And that's the same thing with this. Like, those patients felt better when we restored their curve, but they weren't better because they didn't have a curve yet. We had to artificially induce it. So they should go to their chiropractor and do the things to restore the curve that have been shown to restore the curve, so that they stay healthy, so that they keep normal blood flow. And that's just the one paper that we did on blood flow. And then it's looking at the other aspects of what else happens and what's been published to show that these problems become problems, and how do we fix them? Because there isn't anyone else out there that can really fix it from a structural subluxation biomechanical problem. There's never going to be a drug that's going to be like, oh, it does this, or never going to be a surgery that's just going to fix the mechanics.
A lot of the things you're saying are they're kind of groundbreaking to even me, because I'm, as people say in the chiropractic profession, I'm in the trenches with you guys, and I'm out there and I'm talking to a chiropractor a day. And for the past 5 years, honestly, we've talked to at least one chiropractor a day. So what I've found is like a kind of the weak link is people assimilating and understanding what you're talking about right now, even as a professional standard. And as we want to convey that, one of the topics I wanted to touch on today is the whole idea with X-ray and what that means to the validation of chiropractic, and why some factions are confused as to why X-ray is so important to chiropractic.
Yeah, I see something popped up that from Brandy Morgan. It's so much more than I ever thought, and I learn more and more each day. And let's get the truth out, and we should be learning more and more every day. If we stop learning, I think practice will get boring.
And she's a CA, by the way.
Oh, awesome! So excellent question. We want to get the truth out. We want to learn more and more every day. And, I think when it comes to X-ray, man, I'm probably going to say some things that won't make me popular, and some things that it's just, we want to talk about subluxation, and I'm a subluxation chiropractor. I don't have an MD in my office, and it doesn't mean if you have an MD in your office, you can't be a subluxation-based chiropractor. But I look at X-rays a lot to see what is the shape of the spine, what is the function of the spine, how is it moving, to really identify if there's true subluxations. And there are known pathologies of the spine, known biomechanical pathologies of the spine, which are subluxations that are identifiable on X-ray. It's really the only way to do it. So I think a lot of chiropractors don't, because they're like, I can palpate it. And I've actually shown that with my digital motion X-ray. We can to a degree, but you can't. Not the information that you can get from X-ray. I also think one of the arguments that the anti-X-ray chiropractors have is they say, okay, you took an X-ray of this patient and you see that there's an abnormal curve or instability. Do you have a protocol of treatment that is proven to fix it? And if the question is, well, no, and I can't, then they do have a leg to stand on to say, well, then why are you taking it? So you're finding that there's a problem, but then you're telling me that you don't have anything to fix it. Now, that's one side. The other side is, okay, let's say we take it and we say, well, here's evidence to suggest that what we found on X-ray, a kyphotic neck, instability, all these other problems that we've identified do lead to increased pain and disability and all these other factors. But I do have a treatment that can fix this. And it's a chiropractic treatment, and you can show that. So that, I think, is where someone says, oh, I've had docs where it's a doc that's just saying it to me, or an IME is like, oh, the X-rays were unnecessary. I'm like, oh, so you're saying that not knowing or knowing that they have these problems that were identified on X-ray, and I mentioned their problems, you're saying that it wasn't worth knowing? Explain that to me. They're like, well, tell me how me getting more information about my patient's healthcare linked to research that is in my notes, how is that not appropriate? How is that worth it? Now, here's some other things I can do that I can show you why we're going to try to fix these subluxations, because I can say that C5, C6 is subluxated by 2.7 millimeters or 11.9 degrees, and that could be damage to the posterior column. That's a diagnosis. Now let's fix it, because we know that diagnosis can be linked to some problems.
And as I've come to know, Dr. Evan, is that the spine is life force, and that if we have misalignments in there, it's creating less life force.
It's going to create. I mean, look, there's a ton of studies, and we have this all on my site with videos, that abnormal curves and mechanics lead to increased pain, increased disability, arthritis. Right? There's a study published in Medicine that shows that abnormal sagittal alignment increases degeneration. That's okay. So if you fix that, you can slow down degeneration. Like, how do you argue that having that information is not appropriate? I guess the only way is if they say, okay, well, what are you doing to fix it? And do you have something do you have a chiropractic technique that you can apply to get that better? But even if you don't, knowing and educating the patient, hey, we found this is what it means. The patient should understand what's wrong with their body, and you should give them, we should give them options. And there really isn't a better option other than chiropractic care. I just don't, so the whole argument doesn't, I don't know, man.
Let's take one step forward then and talk about why there's so much resistance to chiropractic. And not only from your positioning, from the resistance for following what's being researched and papers written, but why is there such a resistance to chiropractic from a medical arena? Is it because it actually gets people healthy and it doesn't buy into the sick care paradigm?
I think that there's, what I like to say with that is, I think it's a case by case basis, right? Now, I know that, and this is going to sound messed up or cocky, but to say like why, we can, like, I'm sure and I'm sure people that are logging in know some medical doctors that are pretty good, right? So we can't say that all medicine is bad. And I think when you talk to a lot of medical doctors, like some of the ones that we know, they're like, you need to see Dr. Katz. They're not saying you need to see a chiropractor. You need to see Dr. Katz for chiropractic care. So I think it's, like any profession, it's not our profession. There's people who do great, there's people who do well, there's people who do good, and there's people who do bad, and there's people who do evil, right? So as a whole, it's, a lot of the people that I'm around, they don't say bad about chiropractors, they can say bad about that chiropractor, but not bad about chiropractic, So I think there is a part also, obviously it goes way back where the medical profession has hated chiropractors. And look, I also think there's a lot of money in medicine, man. And that's why I joked with our blood flow paper, I was like, how ethical or unethical would it be if I said, I developed a drug and here are the pre and post pictures. I increased blood flow by up to 225%. And the only side effects so far are the patients feel better. Do you know how much money that drug would do? We just increased blood flow, but no one is we're not getting people wanting to fund $1 million because let's say we show that this increases blood flow. And then let's say we take it a step further and then we show that true chiropractic care by improving the curve minimizes dementia. No one's making money on that.
So what you're explaining here, Dr. Evan, is called, I'm going to coin a phrase. It's called capitalist care.
It's capitalist care, man.
And it's not health care and it's not sick care. It's capitalist care. And now we're pushing medical professionals into an arena that they might not feel comfortable showing up to.
Right, but there are some that we know that they're trying to get out of that medical model, right? Mm-hmm. Because they're smart enough to see that it's actually more lucrative to have patients pay for the care and not worry about the health insurance because they're just going to give them the best quality care. But it's a completely different model, right? And we always say there's a number of ways you can go in your practice, and I'm not saying one is better and one is worse but we think that there's these, there's practices that are going to appeal. They're going to get people in, get people out. They're either going to write scripts or and then you have boutique offices. And the boutique offices are going to say, yeah, we're sorry, we can't take your insurance, but you can pay. But when you're here, we're going to really assess you and give you the best quality care that we think it is. And that's what we're going to get, So I think, imagine, like I said, imagine if they came up with this first study with a drug that showed increased blood flow with no side effects. Dude, it would be like I said, I'd be flying in on my helicopter right now and we'd be donating hundreds of millions of dollars to chiropractic, but we can't publicly trade the adjustment.
You've made it to Chiro Hustle Live. Sit back and learn from the greatest influencers in the profession. This week's episode is brought to you by Close for Chiro, Legacy Wealth Management, Posture Screen, Imaging Services, ChiroThin, Universal Tractioning Systems, Chiro Moguls, Zingit Solutions, Dr. Peter Goldman's Zone School of Healing, Evers Coaching Systems, Rhino Coaching, Chiro Matchmakers, Bax Max, 5-Star Management, and the Goodman Factor. Let's hustle.
That's what I think. So the only person who makes money on it is maybe me. Maybe my patients save a ton of money because they were able to minimize all these other massive procedures and, functioning in society.
This is really what drew me to the chiropractic profession, because I looked at a profession that needed media attention, and it needed clarity, and it needed a bigger voice. And healers are healers. And I think that that's something I really fell in love with chiropractic for, is because I realized that there's 100% belief in the method within the whole process of getting people better. And I saw it working for people. And when I first started out 10 years ago, I was going around doing testimonial videos.
Right.
So my first introduction was people telling me how chiropractic, their life sucked before it, what it was like during it, and why they'll recommend their friends and family. So when I started learning about it, I'm like, who the hell wouldn't bring everybody in their family to get checked by a chiropractor?
100%. And we know, see, that's the whole thing, is we know what we do works. And now I'm trying to do the little bit of contribution. Can we explain it further with science? Like, oh, look, we're increasing blood flow. That could be one reason why they're feeling better. Oh, look, we're stabilizing their spine. We know that an unstable spine increases inflammation that can irritate the cord. So it's looking like we know what we're doing, and the science isn't changing what the chiropractic adjustment is. It's just saying we now have more information and data to suggest that this is why you're getting healthier. We know you get healthier. We know patients get better. Look, chiropractic has been the whipping dog of the healthcare profession forever, with the most money coming at us in a negative way. And we're still standing, man. In fact, we're more than just standing. We're growing, and we're taking over. And
now the other people are trying to take your philosophy and frame it into theirs.
Well, 100%. And now that's exactly right. And now the good surgeons that we've shown this to, they're like, look, we know that if we have to do a fusion, we try to fuse them into lordosis because there's a number of studies to show that there's better outcomes. And now they're like, oh, that makes sense. It seems like it's better blood flow. So they're going to start taking stuff like this. It's so we know it helps. Now we're just starting to look at, well, how is it helping, and what are we seeing? Because we now have the technology to show that. We didn't have that in 1895.
Well, let's back up a little bit. There's a cliche in the medical arena that says there's no money in health. There's only money in sickness. And
in their profession, sure.
But that's just it. It's like chiropractors are building great wealthy futures and great practices because they are keeping people healthy.
Well, I think when you look at that, when they say there's no wealth in health, like go talk to gyms, go talk to organic farmers, go talk to people who sell fruits and vegetables and grass-fed beef. There's a lot of money in health. What they mean is there's not a lot of money in my practice for health because I only treat people when they're some catastrophic something. Well, we're here to say, how do we educate the community to stay healthy? And we're a part of that. We should be a part of that. Just like exercise is a part of that. Just like eating healthy is a part of that. People pay more for a salad than you will for a number 2 meal at McDonald's, whatever that is, right? It costs more in the short on the front end, but it saves you so much money to be healthy than to wait until you get sick.
And this is speaking to innate intelligence once again. Like I was interviewed yesterday for a podcast, and they're like, so tell me a little bit about chiropractic. I'm like, well, the reason that chiropractic is so effective is because when you get adjusted, you don't have to tell your body to heal. Your body takes over because you have innate intelligence inside of you. I was like,
Yep.
When you cut yourself and you're bleeding and you get a scab, you don't have to look at it and tell it to heal. It's going to heal naturally because it knows that that's the state of repair that happens when you are injured. And this is how the body heals naturally. So we have this doctor inside of us. When people adjust us, it just naturally comes back together to like its correct state, and it starts healing. And that's the miracle of chiropractic, is the analyze, detect, correct, and adjust the vertebral subluxation to remove that pressure on the inflammation state, allowing the body to go back to what we know as homeostasis, which is the balance of healing. And that's the real truth of why chiropractic has worked since adjustment 1.
100%. And that's that's what it's all about. But it's also now I couldn't have said it better myself. And it's, how do we continue to keep ourselves healthy so that if we do cut our finger, and let's say you were drinking a ton of alcohol and you weren't exercising and you were smoking and we both cut our finger,
who would heal quicker?
I'll heal quicker. So
because the source is garbaged up.
Right. So let's say, we just had a patient in this morning, believe it or not. Anyway, I guess I can't say her name, but she does jujitsu with me, and she's been under care now for about a year, and she's, doesn't come in as frequently, but she used to have these horrible flare-ups and they would last forever. And now something will hurt, and we can show that her alignment is better. And she's like, she'll get injured, but she's like, it might last only a day or two as opposed to a week. And it's like, yes, because your body is you've been maintaining your body to be healthier by coming in for care and, working on your curve and keeping it subluxation free. So when it does get injured, you heal better. So there is money in health. And, you want to educate all these patients as to the why. Why do I need care when I'm not feeling better? And we're in this massive, especially with, patients in crashes and doctors that treat patients in crashes that, I do as well, is they're just looking at how's your pain? Like, look, man, we live in Colorado. They can go get a gummy and their pain's going to be gone. Doesn't mean their spine's healthier. So it's looking at not just how is your pain today, but knowing what's wrong with the spine. If it's subluxated in a fashion, we can show it. Is there any evidence to suggest that that pattern will make them worse in 10 years? And there is. And that's all I have on my site to try to educate these docs. I'm like, let's educate them, because it's not just about pain today. They're going to, if you leave that, you might feel fine now, but you're more likely than not to lead to further problems based on my clinical experience, as well as all this literature. And here it is in your notes. So then if somebody wants to come and push why I treated this patient more than 12 visits, and I documented and showed it, I'm like, well, my clinical experience, and then I just peppered my notes with all the information from all these journals to show that this is a problem, not just now, but it's going to be a problem in the long term. And then what else in a healthcare perspective can fix that? There isn't.
Bro, the thing I love most about you is your confidence in your message. And I think that anybody out there is watching this, if you guys are finding value in this, hashtag value in the comments there. If you're watching this on replay, hashtag replay, so we know that you watched it. And if you're with us live right now, just push in where you guys are watching in from, so we know where our audience is attending from. But I wanted to go a little bit more like rudimentary, is like, if you took a tree outside, you don't have to, once again, look at it and tell it to grow, because it has innate intelligence inside of it and it's going to grow. But if you started taking polluted water and started watering that tree with polluted water, what happens to that tree? It's going to freaking die.
Or what if you water the one next to it with really good water and nutrients and soil? They're both getting watered. Mm-hmm. Which one's going to thrive and probably be stronger and more resilient? But I appreciate you saying I'm confident, because some people, just call me cocky or, but I'm just confident in chiropractic and confident in what we can do to the spine. Like, this is what we can do. And look at what's out here. Look what's out there in the research to validate what we do. And it's hysterical, because most of the medical journals are coming out with stuff that is only validating what we do, and they don't even know it. They're like, oh, this abnormal movement of the spine leads to horrible dysfunction, so we fused it. And it's like, you do know there's some other methods out there, so let's get the word out there. And use the science to validate, because then it's not just my word. It's, the Journal of Neurosurgery actually supports what we just said here too. So this needs to be fixed. And how do you fix it? You can fuse them, but now you have this, or they can go to a chiropractor and we can really try to fix it. Who's going to say that's not reasonable and necessary? It's crazy.
Well, you said something, your last go was, I looked at you as somebody as confident and not cocky. It's because my headspace doesn't look at you as a threat, and people that are psychologically weak look at other people as something that they may admire or not. And I think that when you come out, when you say these are the reasons I believe in the things that I do, that can be misconstrued very easily. And knowing that you know what you know, a lot of people don't know what you know, so they can misconstrue that as you want to prove yourself at a higher standard, and you do. And that's a part where I admire, whereas some people might look at that as a fear.
Yeah, and I think also, things get lost in translation where we're all typing and you can't hear tone. And I know I can be, I admit it, I know I can probably somewhat be abrasive, but only because I'm like, well, what you're saying is a great opinion, but it's not backed up by anything. So I'm not, when someone questions, like we've had docs question some of the stuff about the paper. I'm like, I'm just saying that, like, you should question it. But now let's talk about it. And I've gone up to the few that have argued it and said, hey, let's do a webinar. You want to talk about it? And they want to do it.
Let's have a public debate. Come on, Chiro.
And no one has ever held me up to it. In fact, I called the ACA and talked to them. I said, hey, let's do straight up. I'll pay for it. Let's talk about the pros and cons of x-rays. Let's get it out there.
Let's have a debate on Chiro Hustle.
Let's do it. Let's do it. And I've emails from them that they were supposed to get back to me like, hey, I'm not here to say that you're wrong and I'm right. I'm here to say we have two sides right now that are saying this is right, this is wrong. But let's get the two sides together to say, look, are you 100% against it and always 100% for it? So let's talk about it and let's see what the information and what is actually being said in healthcare. And you bring what you have and I'll bring what I have. And then we'll just go from there. And it will be, professional, and it will be point counterpoint.
And we could take 10 of them and put them up against one of you.
And you're like, and they're probably going to have some great points, right? Like, oh, that's a really good point. but let's look at it from this perspective as well. So I think, but no one has ever taken me up on that. Even there was only just a few people, and honestly, the few who they are, doesn't bother me. I don't even want to put energy into it, but like, okay, you have some questions about this paper, whether you think it's good or you think it's bad. So I have no problem with talking about it. In fact, I want to talk to you because I want you to understand what we did and what we're trying to do. I'm not saying that the few patients we had, it's all now in concrete. I'm saying we found something and now we want to make this better because this is our profession.
And that's how you break a dogmatic stroke. Is you
Right.
go in and talk to people and you discuss things and you have professional discernment and you come to best practice of methods for outcomes, and you don't do it because the money trail. You do it because of the outcome of the health profession. And I think that's where things get misconstrued, as some of these people might not want to bump chests with you because they don't have the same confidence or cockiness to say, these are my reasons for this. And this is the research showing that I can present to you to tell you why I'm right and you're wrong.
Right. Or to say this seems to make more sense than what you're saying, or that made more sense than what I'm saying. And now let's talk about that. Mm-hmm. Right. But no one is doing that. And I've tried. I'm like, hey, call anyone. If anyone's out there and you want to discuss if an abnormal curve is normal, or you want to say that my paper sucked, or you want to say x-ray should never be done or only be done partially, or you can't move a bone. Cool. That's great. Let's talk about it.
We call those as keyboard cowboys.
Yeah, totally. Keyboard warriors. Yeah.
But I know we're coming up on the edge of our live today. Is there anything that I didn't ask you that you'd like to share with our audience? And then after that, would you share where people can go to find the research that you're doing?
Sure. Let's see. I can't get into the huge details, but I will say I have a paper coming out really, really soon. But you and I were talking a little earlier. I'm really good at getting the information and treating patients and getting the data, but I'm just not good at writing it up. So I'm holding this part up, and we have a paper with me, my wife, Michael Freeman, and Michael Freeman is a chiropractor. He's also a forensic epidemiologist and a master in public health and an MD, PhD. And he's published a lot of papers, and I'm fortunate to have him in my corner and to have him as a friend and even a mentor. And he is making me finish the last piece of this. And what we did is I won't say exactly what, but there's a pathology that all of us are familiar with. And we've seen these for a long time, and there really isn't anything to show that this helps outside of surgery. And what we've done is we've taken a number of patients and we did pre and post images, and we actually showed that what we did is actually fixing and helping this pathology. So now we're going to have a paper that all of us chiropractors can rely on if we see this and say, hey, not only is this a problem, but we actually have something that can help. So I don't have to send them to the only published thing is surgery or something else. So we have that coming out. And then we have another paper that we've been working on for a really long time. It's me, Michael Freeman, Scott Rosa, who the upper cervical doc is on it, where we looked at hundreds of patients with motion, actually how their neck moves, subluxated or not, compared to injured patients and non-injured patients. And the data that we have on this has never been done, where we look at comparatively. And now I can assure you that the evidence that we have and how this paper was done with Michael Freeman and these PhDs and the bootstrap analysis and the confidence interval, that it's almost so specific that even Michael Freeman was like, just doing a physical exam might be just like rudimentary, because we see that if these patients have some of these findings, they are a huge percentage more of having a problem. And then, okay, well, how do you fix that? Well, in my opinion, it's a biomechanical problem. It needs a biomechanical solution, and that's chiropractic. It's not, just doing exercises. You have to fix the mechanics. So we have that. We have those two papers coming out. Like, they'll be coming out pretty close together. I just have to finish up this one little last piece on the one. So now it's just doing this evidence to say, we all talk about some of these injuries. We all talk about how patients get better, but the amount of times that I've had to testify in court for patients against an insurance company, the question is, what information do you have? And I can go in, and my clinical experience is a lot. It's huge, right? Where, as Michael Freeman has told us, we all act as our own forensic epidemiologists. We see it in our practice, and we see people get better. That holds a lot of weight. But now we're also going to be able to come with a paper that's going to say, I relied on this as well. So now, what is some doc going to say? But it's also just an educational piece to go to docs in your community that aren't chiropractors that see these things and say, look, this is the only other paper we have to show that we can fix this. So when you see this, you should send it to us. And if we see something that you specialize in, then maybe we can send to you. And that's how we've just built our practice, by talking to other people and providers of like, this is what we do and here's why. And here's my clinical experience, but here's some evidence to suggest that this is a problem and it needs to be fixed. And I don't know any other way to fix it outside of my office. And that's what all these docs should be using as well.
So where can they go get your research?
So I am presenting June 1st and 2nd with the ICA. I've been in charge of their AMTI, their program on spinal injuries. And we're doing one June 1st and 2nd in Broomfield. And that's through the ICA. But I have a website called professionallyintegrated.com. And you can join us free, but then there's also 2 levels and only $100 a month, like less than 1 patient visit. And then I only hold it open to a few people, a premium membership where I can talk to you one-on-one. And if you have problems with your notes and documentation, I can look at it in narratives. But there's probably 300 professional videos where I break down research. We talk about it. We use it on every patient. You can copy and paste and just put it in your notes. So if anyone questions your notes on why are you adjusting this patient, you just use what you want, and you'll never catch up because I just keep updating. There's constant research. So I buy the research, break it down, do professional videos, and that's at professionallyintegrated.com. And it's how I built my practice, for literally starting at $100 a month. And that's how, one way I'm just giving back. So if you can't travel for webinars or for you can't travel to go to seminars, you could just watch it in bed. And I have hundreds of videos of what I would say at seminars with breaking it all down.
That's awesome, man. I appreciate you coming on as our guest today and sharing so freely and taking the tough questions and making sense of them to people. I know a lot of times one of the things I'll be most famous for saying is most people just don't know where to go or who to trust for their information. So thank you for sharing some good information with our audience today. I also want to say thank you to Dr. Jason Yeager and the Universal Traction System. It's at utsspine.net. They are a generous provider for us to be able to keep chiropractic free speech alive and well in this very confused medical space. So thank you to them for supporting us in all the endeavors that we do. I'm just going to do a quick roll call and say thank you to people for being on with us today. And I know you got patients to take care of in about 1 minute. So yep. Thank you for joining us, Mark Rogers, Brandy Morgan, and all the other people that jumped on to watch our live stream today. Is it okay if I go and close out, Dr. Evan?
Yeah, I just want to say thank you so much to you. I really appreciate being on. I'm honored to be on, and thank you for all you do. And thank you, obviously, Dr. Jason Yeager and UTS. And Jason Yeager's, I love that guy personally. I truly do. And I know him well. And I respect that guy a ton. So I'm glad he sponsored this.
Yeah, so you guys are just one story away. Keep hustling, and we'll see you on the next one. Thank you so much. I just want you to have a good rest of your day, okay?
Thanks, you too, man. I'll see you soon.
All right, see ya.
Bye.
Bye.
Thank you for listening to Chiro Hustle Live. Don't forget to subscribe and check back next week to continue hustling.